Okay, so we've done laying face up. The first thing I'm gonna do is start actually looking up her body to see, I experienced her having kind of a, if you're an anatomy trained student, her spiral line is generally where she feels a lot of relief when we can create more function. So I can really tell, and you can probably feel here as I move through this, right? Mm-hmm. That you've been favoring. And so what I'm seeing here, she does have a little bit of inward rotation. And again, I think that's just a protective mechanism for her spine. And this left hip presents as hitched. But what I think more than anything is that this is weakness from her hip flexor and primarily her iliacus and psoas. And so what that's gonna do is drop into that TFL, right? So when this isn't working properly, it'll start to recruit different muscles to do those same global actions. I call it a global movement with dysfunctional recruitment. So that's probably pretty tender for you there. So some of the things I'm going to want to think about doing is releasing here and even down here, and then kind of go across this, right? So the sartorius attaching right in that medial side of the knee, and then up her vastus lateralis. I don't want to destabilize that IT band. That IT band is there for structure. So as I feel here, so remember the last time we went kind of cross body this way, and I was like, oh, I'm seeing all this shortening. Right. So now I'm seeing it on this side, right? And so one, there's weakness here for sure, but this is also a little hypertonic, right? Just meaning if it's overused, it's shortening up. And so I want to release here and strengthen here a little bit, and release there. So just thinking about like a little rod going like that. Right. And then what I'm going to do is really start down in your toes. We're just going to do a bunch of little work up and through here. And what I'm betting is going to happen is you're going to start to feel this, in that piezoelectrical circuit way, where as this starts to release and that pull, that tension line starts to soften, you're going to feel a little less pain here. And then we can start activating there. Cool?
Sounds good.
Great. Yay! All right.
I feel like the left side usually isn't as bad, but when you were touching
it's bad, girl.
Like I said, it's been, I was up last night feeling the pain. So it's in the extreme case of, but where
you can feel that too, right?
What is that?
What is that indeed? No, again, you get all of, so you pronate down, so then this gets really short. Right. Right? And this whole thing will pull, shortening, just like, almost like a reverse of a bunion, right? Where that flexor lucis longus shortens and then the bunion starts to make way for it. If this gets short, it'll push it out this way.
Is that like the anti-version I have?
Yes.
Is pretty extreme and in pointing. Is that like part of what's happening there? It's just that it's a structural thing?
I think it's a protective thing.
Okay.
And a structural thing, right? We know that there is some structural deviation, right? We know that for a fact. There's no question. Right. So let me know where you feel this. I'm expecting you to feel it through here. Okay. And then also up into here.
I'm still feeling the other ankle.
So, I really think for sure, like, see how I can't really pull on this, even move that? So once we get that moving, See how much better this
Yeah,
moves,
yeah.
right? See, and even how this whole line accommodates, right?
Okay,
And then I'm here, and we have none of it.
yeah,
It's just stuck all through here.
okay.
So by releasing this, then I have access to some of this up here. And, you know, thinking about, one of the things I love about working with Jen is that she's given me, we've been working together for some time, and one of the things about body work is that it's a constant exploration. What worked for her when she came in is not where I'd want to work on her now, because her body is doing different things. It's gone through different things, so it's constantly saying, hey, let's get more information, and the more information we get, you feel that in there,
Oh, yeah, it doesn't
it's a
feel
little
good.
jammed. So we're just kind of softening that up, right?
Right,
So like imagine what you do on your feet all the time, and it's, I mean, it's meant to do two things, to spread and balance when you're on unstable surfaces. And then as you push off of it when you walk, we've gone through this,
right,
it's meant to be a solid structure that gives force all the way up the leg. It can translate efficiently up the leg. And so when you can't do either of those things, then you have to start to recruit muscles up the leg, oftentimes affecting the knee and then affecting the hip. And of course, you know, with Jen, we don't know what came first. I think it's the hip,
right,
because that's structural, right?
right.
And so you've been, I mean, the body's a gorgeous thing. We do all these beautiful, I know, right? So we're gonna
Cringing in pain.
we're gonna hang out in here. And I'm not really even pressing, I'm just kind of going over it, we're exploring, right?
Right,
And so,
until I worked with you, I had no idea how much pain was in my foot and my ankle.
I
It's not
know,
even something I experience on a daily.
most people, so one of my favorite analogies, one of my favorite little sayings is the victim is never the perpetrator. So, the heck does that mean? To me, it's like, where you're feeling it is hyperextended, it's weak. It's a weak point in a chain, and it's a chain that's accumulated over time unless you've been in an accident. So we often treat a lot of our issues as acute injury when really it's a chronic event, right? So when Jen was younger, her body hadn't accumulated the years of dysfunctional or inefficient movement. And so she felt okay. And then as it accumulated, as is the case when you're living, you just accumulate it over time. And so our job as soft tissue workers is really to try to mitigate that accumulation and disrupt some of the patterning through fascial work, releasing all those little dehydrated islands, so to speak, throughout the body. And of course, in the joints are our mechanoreceptors, which produce our fibroblasts, which lay down our collagen, which is our fascia. And so this gives her a better opportunity, and it gives me a lot more resources to work through, to work through that. So you can feel all those little crunchies in there,
Yeah,
right?
and the crunchies are.
Fascia. Yeah, it's like almost like calcified. You know, it gets so dehydrated that it becomes solid. And fascia is thixotropic, which is a word I use a lot. What it means is when it's in movement, when it's in motion, it softens. Which is why when you're like working out, you feel awesome, and the dopamine and all that stuff. But it's also why when you sleep, you really feel it. You know, you feel the workout because you're sedentary, and so the fascia begins to get sol or gel-like. And because your nerve endings live in your superficial fascia, see even through there?
Yeah.
And it's gonna get worse as we get further out.
Great. It's already pretty bad.
Right? So let me give you just a little bit of a proprioception. This is how hard I'm going.
I know. I believe you. That's always the case.
I know. So, and then once I'm done with this round here, I'm gonna ask you to just kind of move your hip around,
Okay.
move your lower back around, and see if we've affected any change up that chain, okay? Which I think we will. And then we can start to get you into some more global release. And hey!
I was like, no,
Well, we both knew that was coming.
Right.
We'll get in there a little bit further. I think I might even do that with you sideline. We'll see.
Okay.
I'm not sure yet. Even in there. You feel that?
Yeah.
So all I'm doing right now is going through the joints of her phalanges in her foot, and then going into her metatarsals and tarsals up toward the ankle, trying to create movement. I haven't touched her plantar fascia yet. A lot of times, if this is really tight, I don't want to destabilize this. I'll soften this first and then see, because this actually presents as a little bit weak. So while it's important to release it, I want to give it a context to go into neutral once I release it. We've worked a lot with strength, so she has exercises she can do at home. So what have the doctors been telling you? Can you hear that?
Yes. It sounds like you're like flicking a balloon or something.
I know.
Or like a rubber band.
So I'm just gonna try to give a little bit of movement there in that joint.
And you're on what, the middle or the fourth?
Yeah, just the middle. And it's gonna get worse as we get out. I mean, pretty much. But already, can you see how there's more movement here?
Yeah.
Right?
Yeah.
And so it's because we're taking kind of where you're more functional. We need to get into here too. But and then going out through the foot this way. So I'm helping that fascia move into the restricted areas so that they have a bit of an easier time releasing when I go there. I'm not going to go in there cold. I'm not going to go in there and be like, ooh. I always say, when you're in pain, when you've like fallen down and hurt yourself, do you want to have someone yell at you? Or do you want to have someone give you a lollipop? Maybe a hand up, right? All right, come on, get up. So all of this is you just working really hard to try to keep yourself stable.
Right.
Most people don't walk properly. I've been threatening to make a video about walking properly. It's just so
I recently came across something they have in the city at one of these Pilates studios. I'm forgetting the actual trademark name of it, but it's like gait trainer, G-A-I-T.
Okay.
So it looks like you kind of stand on it. So you slide almost like a Pilates reformer. But I don't know exactly how it trains. But it was something I was like, oh, I know I don't walk properly.
Well, is this like a machine, or is this like someone will help you and guide you through?
You do a session with somebody.
Okay.
Yeah. So you're on something that looks sort of like a reformer.
Yeah.
But with you don't do it by yourself. It's with somebody.
Okay.
Yeah.
Because one of the things I can't stand is when people are like, "Oh, just use this machine,"
Right.
and I'm like, "Okay, you're gonna use the machine with all of your patterning,
Right.
like it doesn't."
But I also feel like after seeing you, even if I were to go on something like that in the condition I'm in, it wouldn't allow the proper movement regardless of what the machine was telling me to do.
Oh, I'd say so.
When you saw me walking in today, what did you notice that was?
That inversion there.
On the ankle?
Yeah. And also, you have like this weird little, I want to call it like a swing through your hip.
Yes. Yeah.
And so, although I will say, it's not as bad as it once was.
Yeah. It's just my supermodel walk. 5-inch unstable.
Right. Yeah. You'd be one of those supermodels that like falls like as they try to turn on those heels.
Right.
I always wonder like why that is. Is it because they're lightheaded? They tighten in? You know, or like is it like the cameras are like flashing their faces and then they don't know where they are, they lose balance?
Or maybe their muscles are in full dysfunction like this and they can't stand.
Oh, I'd say that's probably true. I've seen a couple models in my day, and you know, the issue with being that skinny is that your body takes from your muscles to give to your organs. And so you're actually in like a weird state of atrophy when you're in malnourishment, because that's what it is.
Yeah. Well, and then on top of it, to be that tall, I mean,
Yes.
I would just think the mechanics of all of that would be.
Well, you know, it's during the growth phase. So if you have a growth spurt, your muscles have to stretch to make way for your bones. And if you don't, that's feeling better.
Oh yeah.
And you have to kind of relearn how to move, right?
Yeah.
Remember those awkward, like, stepping over your feet thing,
yeah.
you know?
Oh, yeah.
Oh, God. So we're really starting, hopefully you can even see it, there's just a lot more movement. I'm even able to start, like, doing some of this.
Was that me cracking?
That was you! that's when you know it's really good. You're like, who am I? All right. So now we're going to go into the pinky. We're going to spend a little bit more time there. I'm going to go up this side of the foot. Actually, let me get a Graston tool. No. The first time Jen ever came to me, I did Graston on her. And it was hilarious, you know, because she needed it. I mean, she was just so hypertonic, nothing was moving. Her whole vastus lateralis was just rock solid. So I talked her through it. I didn't just do it. She knew it was coming. I said, well, you know, this might make some marks, and
some marks is a little bit of an understatement.
Some marks. She was like,
I was purple from hip to ankle.
Yeah. And so she texted me and was like, is this okay? And I was like, yeah, in fact, it's really good. And she went and saw somebody else who also verified that, you know, it was okay. And I didn't do it on her cold. I really warmed it up, and I made sure that, you know, her body was ready for it. Oof. Feel that there?
That doesn't feel super. Oh yeah, that one. Oh god, yeah, that part feels good.
Yikes.
Yeah.
I know, right? So what I'm going to ask you to do, I'm just going to hang out here.
Okay.
You let me know if I'm on that tender point.
Okay.
Am I on it?
No.
I think it's right here.
Yep, that's it.
Okay. So I'm going to just stabilize it a little bit more. We're going to hang out here, and I want you to tell me when it starts to release, okay?
Okay.
Ching. All right. There we go. Breathe it out and clench your butt cheeks. Smile, relax your eyebrows. Give your body signs that this is healthy and good. So I'm feeling a little less
bearable now.
So you should be feeling a lot less pain. Discomfort. I just hired a new therapist, and she said, she used the term therapeutic discomfort. I was like, ooh, I'm taking that one. Shout out to Rachel.
That's a much better way of saying pain.
Right? Well, also, yeah, because a lot of times it's like, you know, pain again is a neurological condition, so it's not happening here. The stimulus is happening here, but the experience of what's happening, it's in the brain. It's a neurological condition. It's the way we perceive what's going on. So it can be entirely dependent on, I'm gonna find that, right? Yeah. We'll just hang here, okay?
It's actually like a burning.
A little burn, yeah. So we're right over the joint, which is where tons and tons of nerve endings are. So that's why you'll feel that, right?
Yeah.
So tickling is actually the same neural pathway as pain. It's just that our brains perceive it a different way. Pain, I think I was saying that it's reliant on how we feel, what we're thinking about, what we ate, how tired we are.
Hormones.
Our hormones. Hello, ladies. And of course, our hydration, our facial hydration, our cellular hydration as well. They're two different things, although correlated. Cool. All right, so we're just going to move that around. Much better, much better. So even as I pulse, so we're still seeing a lot of resistance through here, right? This should just turn and move down really beautifully. So we're going to start moving up. And this is where I'll bring in the Graston tool. Almost the same radius, but a much different handhold for me. Cool. And I can hook around here. And this is a really nice vaginal pull up this way. Cool. So since we've just gone through the toes, I just want to give you some proprioceptive cues. So just move your hips around, move your back, see where you were feeling some of that pain before, if you're feeling less restriction.
Yes.
And then I also want you, isn't that cool?
Yeah.
We haven't even really,
right.
We've released this hip slightly, right? We've done a very light traction and moved the ankle a bit. See how much better these move? These are moving a lot better now.
The funny thing is, I came in feeling super tight in my hip SI joint area, and now I feel that feels a little better. And right now, I feel it more in my upper shoulders.
Yeah,
like it's moved up.
So one of the interesting things about this is, one, it's a detoxifier for sure, but your body will really react and respond to this. So if we don't actually move up the body and release up into her head, I do a little bit of craniosacral work, particularly when I'm doing deep work in the feet, because it'll some of those patternings, right? It can get stuck in different areas, and then she'll feel that more up the body if we don't address them. And as we work up further, your shoulders should start to feel different too. So yeah, it's been really funny watching these videos, right? Because I'm like, oh no, I need this, and like editing. And I was like, no, people are just like doing their thing on camera, right? And I was like, I could do that. I could do that.
Now I'm feeling the tickle.
Yeah. Great. So relax down into me. There we go.
And now pain. Right from one to the other, even if they're the same thing.
Right. You're like, whatever it is, it hurts. It's therapeutic discomfort. Come on.
Right.
All right. So another thing that I notice about Jen's feet is that she gets calluses and she'll get blisters right underneath that second toe, pretty much all the time, which lets me know again of that kind of that flat-footedness and that she's not using her big toe and pinky toe the way they're meant to be used. You actually can walk with only your big toe and pinky toe. But if you lose one of them, you'll never really be able to regain your balance. And a lot of times we turn them off when we walk. Most people really heel strike, they walk from the back of their knee, their hips are tight, and so they have these weird little deficiencies right at their end, the end range of their gait. I'm working with someone right now who's a very competitive athlete and has great form on a lot of levels and can't do a slip stop bridge to save his life. When we isolate his hamstrings, he literally cannot move them. It's bananas. So, and he has severe knee valgus. So we're gonna start working on that soon. I'm excited about it. Next week. Yay.
I know working with you, one big thing I noticed about the toes was the first time you asked me to move my big toe independent of my other toes.
Yes.
And vice versa. I was like, you're crazy.
You're like,
you could do that. You're like, watch me.
I was like, I can do it. I can move almost every single toe independently.
And now I do work on that and practice it. And just this week when I was in a state of inflammation and pain, or excuse me, discomfort, I was testing my toes. Like, can I still do it? And I could. So they were still able to.
Okay, well that's good. And it also gives you kind of like, hey, my nerves are still functioning.
Right.
And it's just a really good exercise for your brain as well. What's really cool is you can do that for a lot of
Sorry. A little twitch.
A lot of your nerves. Okay, so I'm going to ask you to point and flex your foot. Good, and then flex it. And then point and flex.
Are you on a muscle right now?
I sure am.
An unhappy one.
Yep. These are some of your flexor muscles, right? And they actually go up into the peroneals, right? So you can even see it working there. And relax, good. And then, yeah, just try to relax, right? There we go.
Lots of popping happening.
Yes. Cool. All right. So I'm just going right behind that lateral talus. And we're just going to give it a little bit of a pull. A little bit of traction. Bing bang. Bing
Smile,
bang.
smile, smile.
Smile, laugh, breathe. I always like to think of another area in the body to distract the brain. So it's like, tell me all about how like this cold thing feels on that leg, you know? Because it's distracting the brain is a really good. It's like a toddler. It's like, oh, shiny and cold or what? Yeah. Laughing is also really good. Have you ever tried laughing yoga?
No.
Yeah, so there's this really cool laughing yoga, which you do this thing, ho, ho, ha, ha, ha. And I tried it once.
As a distraction, or is it a muscle?
It's to make you feel happy.
Okay.
And it did. I felt very silly.
Right.
And that was nice.
Is that like goat yoga?
Good Lord. Like, all these yoga things. I mean, why?
Right.
Why? What, like,
I don't know.
maybe if you
I was
like,
thinking happiness when you said there's a bunch of goats walking around and be
goats
like,
hanging out on your back making you happy.
Like, what? I'm more of like a state of what reality am I living in?
Right.
Now,
I mean, I've done yoga with corn nuts.
You have?
But that's because he's my dog and I love him. And I'll be like doing something and he like gets up in my face and is like, you're on the floor, play with me.
Right.
I'm like, oh, I'll do it. But, you know, you have to go into downward dog with me.
Right.
And he's like, I'll do it.
That happens
my
with
face.
mine too. When I try to do the foam roller exercises you had me do on my upper back, as soon as I lay down, my like 35-pound dog seems to come like lay on my stomach. I'm like, I don't need extra weight, so pushing me down to the foam roller. When you just worked on Kia, does that feel like it normally does, or was it more?
No, it's definitely tighter. It's kind of interesting. I feel like you've been really trying to guard this hip, and so you're doing all these different things to not put weight into that lower back and hip, and so we have a ton here,
right?
And this is tight, and this is tight,
right?
And then everything else is.
And the guarding could be protective against the cyst or the labral tear or all of it.
the position of your femur.
Oh, okay.
Yeah. Because I really do think, cysts occur because of inflammation. And so then you have to wonder, why is the inflammation occurring? It's something that we don't address very often, at least in the Western allopathic medical paradigm. So what they do is they say there is a cyst, let's get rid of it,
right?
But not why is the cyst there, let's deal with the reason it's there.
Right.
And I think that's when you say like missing link, that's what a lot of it is this idea of, so we're gonna do this same thing on this side here.
Oh God, that hurts.
That's still really tight. But feel that hip, even start to feel, so what I like is that your hips are really starting to look a little bit more even. You definitely want to get through that lower lumbar. I know, but move around, feel the hips, and then we'll move up.
Okay. There we go.
Yeah?
Yeah, because now I'm only thinking about that ankle now. That distraction technique works. What was that? What you just did there?
Yeah, so it's just a little bit of structural release, right? So I'm just creating a little bit of space in between your bones.
And what is telling my body why is it telling my body that hurts?
Because you have fascia that's tight and, I wouldn't say calcified, but it's adhesed and it's dehydrated, and so it can get to a place where it's solid almost, right? And then when I move it, the nerve endings that live in it, right, 80% of our nerves live in it, become innervated, they become aggravated, right? And so what you're experiencing is the compression onto those nerve endings within fascia that's tight, right? Did you get that? There was an analogy by Sue Hitzman that I really like when it comes to nerves in dehydrated fascia. So, like Twizzler string, how it's kind of pliable, but it's fairly solid, right? And then, Jell-O. So if you were to take those Twizzler strings and put them in Jell-O. All right, this is going to feel a little funky. There we go, that feels better. So I was feeling some tension through here, and I could tell that it was coming from over here. There was still a pull. So I just stretched a little bit. We got actually a couple of little cracks in there. And then this is much softer. So that's a great example of the victim is not always the perpetrator, or almost never the perpetrator. About 5% of the time it is. And that might be generous. So if you were to suspend those Twizzler pieces in a bowl of Jell-O, and then the Jell-O sets, and you move the Jell-O and it's kind of wobbly and warbly, that's how, and these Twizzler strings move with it very freely and softly, right? That is healthy fascia and the nerves sitting in it. So when you jiggle it, there's no pull, there's nothing, it just moves as one unit and it moves freely. But if you leave Jell-O out, as we all have, it becomes restricted, tight, short, right? It starts to pull away from the sides of the bowl.
Right.
And then if you think about those Twizzler pieces, sitting in the part that's now been exposed to the air for a while and has become dehydrated, and you try to move it, the Jell-O that's still healthy will move, but what's in that dehydrated part isn't as tight. So when if we were to try to like break that up to soften it again, which is where the analogy ends, right? That would and those are nerve endings, right? So that's for feeling. You would feel that, and that's kind of what's going on. So if you could like shake Jell-O back into hydration,
Okay.
you would have points of discomfort during that process.
Yeah, it feels like some of the other things, like when you were doing that point on my pinky toe, the pain felt different, then the discomfort felt different than when you just shook the ankle like that. Maybe because there was so much going on, but the ankle was just like, no.
Yeah. And also, you're actually getting a lot more movement, right?
Yeah.
You can feel that. So I give it a rest. I give a little bit of time for the fluid exchange, right? Because again, the fascia moves throughout the body constantly. So once you have flow, it'll start to move on its own. And then
that area is where you're pushing. It's just super sore, like bruised feeling.
Yeah. Because it's not moving, it's solid. And so as I do this, you can kind of see how it moves up the leg. And that's where we begin to address some of the shortening through here. Cool. So, relax for me. I like to come in here. I like to shorten some of the muscles that are really tight, particularly on Jen. This, like the intercerosus behind the ab mag is always tight. And a lot of times because she's constantly pulling her leg back in from sweeping out, right, because of the glutamine deficiency. It's pulling it back in. It's this tiny, thin little muscle. I mean, it's not tiny. It's a thin muscle that isn't designed to do that.
So does this get into where I told you I went to see a PT recently who said, oh, you have a hip issue, do like a pigeon pose.
Oh my God.
And I came in to see you right after because I was in state of shock or trauma, you call it. I was in trauma. So if I have a hip issue, why was a pigeon pose a bad idea?
Sure. Okay, so this is a really great thing. So a lot of times we think, okay, you have some pain. I'm going to fix this here so we can just see me, so it's not just like weird. That should be better. So Jen's asking, she has some hip issues and she needs to strengthen, and she does need to strengthen, and she needs to soften as well, right? She needs to lengthen some of that tissue. And so some of the things that people always try to do, where it's just incomplete, and in this case really inaccurate, is putting that area that feels tight into extension. But that feeling of tightness can often just be collapse or dehydrated fascia because of dysfunctional use. And if it's weak, then by putting it into an extension, you're actually just destabilizing the muscle joint. And around each joint, you have these fascial slings. Ming Chu is a physical therapist, really, really incredible research done on the fascial slings that support the joints and keeping them buoyant. And see right in there?
Oh yeah.
So we're gonna hang here for
That
a
doesn't
second.
feel like a muscle. It feels like a bone.
I know, isn't that
It feels like
crazy?
you're pushing on a bone.
I know. Cool, so just engage into my hand here, good. And relax. So I'm on our Golgi tendon organ. We'll get back to the fascial slings in a second. I'm on our Golgi tendon organ here, which is where the fascia and muscle meet. And what it does is it preps the tissue, the muscle, for movement. So it makes the ligaments and tendons more taut and the muscle a little bit more long. And so by stimulating that, I'm actually creating length in the muscle rather than the tendon. And push up into me again. And then by activating, we're actually giving her some movement through all of the little fibrils and the fascia that wraps it and surrounds it to help create a little bit more tone and length. Relax. And that's already feeling a lot better. So oftentimes when I come across a muscle that's guarding and tight and in distress almost, I like to soften it up, but then use some of this isometric release. Press again. And relax. So this time I want you to use your glutes. I want you to activate your glutes first, squeeze your both cheeks, and then push up into me. Good, you see the difference there? Huge. Press, press, press. But. Yeah. And relax, good. Ooh, yikes.
That is actually a good hurt.
Yeah.
Not like the ankle.
But the ankle gives us access to this.
Right.
Cool. So I'm just gonna look at this now. To me. So when you have issues, I want to release that pubic symphysis. Bring both your knees up for me. Put your feet on the floor.
Together?
Yeah, and then just press your knees into me as much as you can. Keep going. Press, press, press. And release. Good. And press again. And release. Good. Let's see how that feels. Put that down. Oh, that feels a lot better. Cool. So, I know.
Some of these are just like a total instinctual reaction.
I know. Like, get off of me!
I can't stop.
Great. So I just did a little bit of a pubic symphysis release. That's the joint right at the front of your hips. It's actually you can do it yourself as well.
How would I know that I need to do that? Like if I were home?
Yeah, well, I mean, generally I would say so if you're feeling really tight here and it crosses that line, generally that's a thing that you'd want, but you'd want to do it, you don't want to do it right away. Like I believe in chiropractic, but I also think that the muscle should be released first.
Okay.
Instead of doing something aggressive and then like, all of the nerves and the soft tissue around those joints are kind of in trauma.
Right.
You can also do stuff where you're softening the tissue and then mobilizing those local what do I want to use? What word do I want to use? Structural deviations. Just as efficiently, a little slower, but healthier, I think. Oh yeah. So we're just kind of at that iliosacral crest. Right now I'm on the anterior superior iliac spine, prepping to release the vertebrae and the lower back and things like that. So we're going to go into a sideline position soon. So with the fascial slings, as your muscles and your fascia get overworked, they begin to fail. Now what happens is your bone drops on bone. And then you keep going and you feel it, and then of course the cartilage is kind of like a safeguard. And then that starts to wear away, whereas if you were to actually have length and tone through those areas, you would be able to keep those systems buoyant and off of one another, gliding against the soft tissue. And so if you have an area, particularly right at a joint where you're feeling pain, and then you go into a deep stretch of that joint, if the muscle is weak, then what you're doing is you're destabilizing that area and then essentially forcing failure of those systems that are keeping those bones in place and buoyant and off of one another. And so if something's pulling on, like for example, her psoas is pulling, or maybe her obturator internus, and that's not released, but you're just releasing the glute med or piriformis, then she's kind of losing the tug of war, so to speak. So that's why. Does that answer?
Yeah.
Yeah, hi. It's cool.
I forced myself to let it go, but the initial reaction is like, punch.
I know. Oh, by the way, we got this great functional fitness guide.
Yeah.
Yeah, so we're doing all these semi-private movement classes down in.
Oh, it's new. Is it all done? Have you seen?
Yeah, there's still some decorations to be done, but yeah. Oof, do you feel that right there?
Yeah.
So I'm just, what I'm doing is I'm pushing, so from all this up, and I'm gonna go back and just check that foot.
Okay.
I'm gonna work on the foot a little bit, and then we're gonna turn it.
And what are you on right now?
I'm on your adductor. Yeah, your adductor longus. Yeah, longus and magnus. And
that's the weak muscle?
So that's, yeah, so locked long.
Okay. Is there anything at home I could be doing for that? Like a stick or foam rolling or anything, or is that too?
You know what? There is, but there's this 5-inch ball that I would want you to use.
Okay.
Yeah. I don't love this stick for in here.
Okay.
You're just kind of pushing stuff out of the way.
Okay.
Like it's meant to be really mobile.
It's just, it is a tool that's easy to get.
Yeah, it's super easy.
Right.
The ball's super easy too. So you should actually check out some of the classes.
Okay.
I'd like for you to see Nancy's.
Okay, yeah.
And the drop-in rate's like $30, so
Yeah,
it's
yeah,
not,
definitely.
but you get like one-on-one attention.
Yeah.
And then I also am teaching some self-massage classes.
Okay.
Where like that would be something we could address.
Right.
And really actually from the foot. So you see what she's doing with her foot right now? So what that does is it completely, and I can feel that up here, that's why I'm looking down there. So let's get you on your foot.
That's my go-to.
Yeah. So we're just gonna start getting into that sartorius now. You can feel that. Holy moly, this thing is rocked. What? So again, this is a muscle that really activates when you internally rotate your leg. So when it's here, it's short. When you're turned out, it's short. And as you turn your legs in, it actually lengthens. It is just solid. It's like a little band.
You always make me feel better about myself and validate. When you come and start cursing at my muscles, like, they really are that bad. It does feel bad, and you're validating that for me.
I can feel it though, that's the thing. I mean, that's where it is, right? So yeah, of course you're gonna feel it on the inside of your knee.
And well, actually, I mean, it feels bad when you're touching that right now, but in my my actual, how I feel my pain is really just in the SI joint.
Yeah.
I don't feel all these things on my day-to-day.
No, of course
unless
not.
I touch them.
Because you're feeling the victim.
Right. But as soon as you start touching them, I'm like, my pinky toe? Oh!
And then what you see is a release
Oh yeah.
through those dynamic vaginal lines.
And that's probably where that spot up near my knee is what I came across probably about 2 weeks ago, but on the other side.
Right.
That I touched it and I'm like, why is this so tender?
Okay, I think we're ready. Right, you're like, what's going on? So, let's get into the other leg. I feel pretty good about that. Let's see. Good. You still have some here. So this should be able to just spread out as I push into it here, and it doesn't. So I'm gonna leave it for now, just for time's sake. But it's something that I want to bookmark and come back to. So just stop giving everyone a show over here. Great. Cool. So Jen, the pronate's pretty hard on both feet, but she doesn't have the structural deviation in the hip. So while we still feel a lot of destabilization, hypertonicity, locked lung, so to speak, in that plantar arch, it's something that we can really functionally address, whereas on this side, a lot of it has to do with just mitigating some of the accumulation of dysfunction, right? So it's kind of two different goals for her in particular. And so you can really see as I move through here, we have great translation through the knee and up into the hip. Again, her obliques and maybe even her transverse abdominis are activating as we internally rotate, which lets me know that that TFL on both sides needs some loving.
That one's worse than the other side.
Yeah, because you've been
using this one.
Yeah, you've been. You've been favoring it.
And I do have after my CT scan, the anteversion, femoral anteversion on my right, on my back side, is 43 degrees.
Yeah.
And I think the normal is 12 to 15.
Yes, it is.
But this one is actually 24, I
Right.
think. So it's still outside the range of normal, but I don't have any, none of my hips or anything on this side.
Yeah.
Nothing on the left
I
side.
really want to see if we can start releasing and strengthening the paraspinal muscles around that L5.
Are those multifidus? Is that?
The multifidus, paraspinals, yeah, all those things. If we can start to like activate some of those and start to release that L5, I'm really curious to see what you'll feel through that hip.
Okay. What do you think about, I know the first time I saw you, you said that my glute max on this side was atrophied.
It does, yeah, you are. A lot of your glute on your right side is atrophied, yes.
And if he's not carrying his weight, is there any, well, when you're saying about activating, could we activate that as well?
I would almost want to see, because we have, right?
Okay.
We've gone through isolations for you. So notice on this side, I'm actually doing kind of an internal rotation. And that's essentially to start getting that TFL just a little bit softened. We're gonna move up the peroneals here to start creating space and movement here. Now I'm not doing that on the other side because of all of the dysfunctions that are just different, right? So I'm not gonna treat either both sides as though they're the same. She's not bilaterally symmetrical. So because we've activated those muscles and there's not a lot of change, that's letting me know that we have to look somewhere else. And especially with kind of the new information that you're getting, looking at that L5.
Right.
And I've been actually learning some really interesting stuff about what happens when we have local movement in that L5.
So my hip doctors, I just talked to them 2 days ago.
Uh-huh.
The main one, he consulted with the second opinion that he sent me to.
Okay.
And they're like the top hip doctors in the country.
Yeah, over at special surgery, right? Yeah.
Said, your case is very atypical and extremely complex, and we want you to see someone else as well.
Oh
so
my God.
I'm now scheduled.
So like nobody wants the responsibility of what's going on with you.
Because doing the deep rotation is such an aggressive, invasive surgery, and because I don't present with any hip pain in my groin or my hip socket,
right?
They are apprehensive to do that,
sure.
which is great. They're not, surgery.
Yeah, they're not like
happy, right?
Right.
But all of my pain is in my SI and L5, but I haven't actually had much. Like they've done MRIs and CT scans and X-rays of my hip.
Right.
So no one's really looked at my spine yet. So, and I mean, that said, when I first started the journey, I did have injections into my SI joint and it didn't help.
Right.
So that piece of diagnostic information was like, okay, let's look elsewhere. But now the next step is to get an MRI of the spine.
Right. But also, if there's weakness in that area, then an injection isn't going to help.
Right. And there definitely is weakness.
Yeah.
I mean,
we know it.
Right. And I'm just lax altogether. And I'm going through right now also. I think I may have mentioned this to you, but I met the criteria for Ehlers-Danlos.
Yeah. You did mention it.
The hypermobility connect collagen.
I actually I have a lot of people like that.
Really?
Yeah, because it when you have that
hypermobility.
Yeah.
Or the collagen aspect of it.
They call it where you're more lax, just around your joints. Those slings that I was telling you about, they fail, right? I know, girl. So we're just starting to release through the sternocostal joints to start to release into the abdomen for this action here. Oh my God, the sun just came out. What is that? And Jen has a slight diastases, but it's very, very minimal. But it is still something that you want to be aware of, or I want to be aware of, as far as what kind of abdominal exercises to do. No crunches, right? That's like every woman who's ever had a kid.
Right. Gains 50 pounds and bends over.
Wash.
Yes.
I have men who have it.
Really?
Yeah, it's just anytime your belly gets distended. One of the best ways to deal with it is twists. So if you have think about like two pieces of fabric that are apart from each other. If you twist them together, there's no pressure this way, right? Whereas if you're pulling them this way, they will bow out. Okay, cool. Feeling really good. That felt nice. I'm just checking the diaphragm, which of course comes all the way around the ribcage and attaches right above the iliosacral crest. And again, lax on the right, more tonic on the left.
I have to release my clenching here.
I know. All right, so what I want you to do is think about pressing your lower back into the table and then pressing my hands out of their position. Keeping the back on the table. Keeping your back on the table. Press my hands out. Press, press, press. Keep going. Good. And relax. Right? Already more movement. And press your lower back into the table. Really all the way down. And then press my hands out. press, press, press. Keep going. Good. Let's do that again. Relax completely. I have to get in there for you to push me off. All right, go ahead. One more time. Good. Great. Good setup. Good job. Oh, that feels so
Be able to breathe.
Yay! Alright. So I want to release this side first, and then we'll do some activations on that side.
I will say, I have been feeling it, like if I would imagine the butterfly, the top of that.
Oh yeah.
That's where I'm feeling a lot of, like if I could just grab it.
For sure. And a lot of times when you feel that, it's your glutamate. So pain in that, kind of up here has to do with weakness here. Okay. Right? Because everything's dumping. So turn onto your right hand side for me. Get a pillow for you. And just get nice and comfy. Come into a nice deep fetal position. So I always do my my psoas releases on this side. What it allows for is better regulation of that vagal nerve, which the psoas is a direct kind of in direct relation with. And it also gives who's ever on the table complete control over what's happening in their body. So this is a muscle that I'm very, very cautious to have any kind of strain or guarding, because it can disrupt a whole number of things, even the peristalsis in the intestines, a whole bunch of stuff. All right. So I'm just kind of feeling around here, just allowing that to come. So I'm just going to ask you to take that top leg and extend it fully back for a nice little stretch. Yep, you can feel that stretch there. And relax. Can you get your foot past the table behind you? And down. Yeah, good. Good. There we go. That felt nice. You needed that. So again, just by doing a little stretch, I felt a little restriction in like her L3, L2, and just by giving her a nice light little stretch, that was able to kind of go back to where it needed to go. And bring that leg back in. Cool. Now I don't do structural alignments, but if you feel something and the muscle can release it, awesome. Oh yeah. So we're right into that TFL now. And one of the things I like to show people is when you're in this flexed position here, meaning the knees are kind of flexed into the torso, and you think about SI joint pain, you can actually draw a straight line from here to the SI. So we often think of it as kind of going around the glutes and all this stuff, but if you think about it functionally, particularly for those of us that sit for hours and hours and hours a day, that stress line, those fascial lines, that dynamicism here is literally, you can just draw a straight line. And so it's really good to think about what's tight when your lower back feels it. Vastus lateralis, rectus femoris, sartorius, TFL. Instead of just going directly into the back, and of course, the psoas, being in passive contraction for hours and hours and hours a day will certainly lead to a shortening of the psoas. So like anytime you stand up or try to lay straight down on a table, that's your psoas right there. You just raise this arm up over your head. And then I'm just gonna start to pin her lat, which does attach right into that SI junction there. And move it around. Good. And I'm pulling away, giving it a little bit of a stretch. Whee! All right. So at this time, I'm just going to ask you to activate, and this is part of what we're going to do when I turn you over the other way, but to a much larger degree. Just bring your top knee and your foot up to hover off of your leg. And relax. So this time what I want you to do is think about pushing your butt toward me and then doing it so you're not dumping into your lower back there, okay? So push your butt towards me, little twerk, and then lift that knee and foot. Yes, you see that right where it activates. Twerk, 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 twerk. And relax, good. So again, just stabilizing all of the muscles that attach the hip and the ribs. Breathe, smile.
And wherever you are is not happy.
No. And that's the TFL. Awesome. So just clamshell up for me once. Good, and relax. Good. Awesome.
Lift this up yourself?
Yeah, just gonna get through. Her shoulders round a lot. This will be, she's not the person that I want to focus this on, but for sure. This is a whole other session, really.
Yeah, I know.
But when people have a lot of pain through their chromium process, just through their traps, if you're looking at, victim perpetrator, man, you gotta look at that serratus anterior and those intercostalis. All right, so we're just gonna pop you over to the other side. Nice deep fetal. Great. Oh. So scooch down just a little bit. There you go. Good. How's that feel? Good. Great. Okay. So first I'm just going to kind of go through here and feel. So all of this is really spongy and weak, really until we get to that posterior superior iliac spine. And she's making little wincing and
I know that's the spot that's been bothering me.
yeah. So we're gonna pop into there for a little bit, but then I want to release. So I'm gonna release that and just feeling in. I actually feel like I almost want to release. Well, we'll definitely get it here. You can feel that, right?
Oh yeah, that's my spot.
That's your spot. So we're gonna do a little bit of a twist. I'm gonna release through here.
Toys.
Taking out my
It's
toys.
always bad side. In the short term.
I have a whole bunch of tools that were handmade by this phenomenal massage therapist. I can't think of his name right now, or the brand, but just some of the most functional, thoughtful tools made by someone from the profession. I wish they were more popular for everybody's sake, because my clients benefit, they're getting better work, my hands benefit, I can do more, I can see more people. Woof. All right. Cool. Okay. So I'm going to start doing some activations with you. I'm going to tuck this kind of in between here so that we can keep you somewhat modest.
Okay.
All right. So with both of your knees, I want you to start pressing into my hand. Press up into my hand. Press, press, press. Good. Keep going. Keep going. Torque that butt back. And keep going. And release.
I'm having a hard time finding what I need to do.
Yes, it's because we're activating the muscles around that L5.
Right.
And it's hard. You're like, what are you talking about right now? I'm not supposed to be able to lift that. All right, go ahead again.
So should I put my foot back first?
I don't want you to like push it back. I just want you to activate through your pelvic floor. Okay? And not tuck in. right? So activate kind of through here. Yeah, I want you to feel it like that bowl underneath your belly button. Okay? Cool, can you feel
I
that?
think so.
Great, and press up. Good. Keep going. Press, press, press. Keep going. Keep going. Keep going. And relax. Good. Good. Let's feel that out and see how that feels. Awesome. So we're getting some movement. Definitely need to get into the psoas here. Try to relax down for me. Thank you. Yeah. So her iliacus is doing a ton of work in here. Can you just move that around and just see how it feels? A little bit different, right?
Yeah.
Yeah, we're actually aligning a little bit better. You can even feel as I palpate that, it feels so much better, right?
Ooh, that's actually more sore than I thought.
Yeah, the other side is actually quite sore. And I'm going to release that too, so I will have to turn you back over. Okay, cool. So let's get into that iliacus a little bit. So bring this knee up a little bit more and relax down for me. Good. You can just do that. And you can actually bring both your knees back slightly if you wanted to. Yeah, just a little for a little bit more support. Does that feel okay for you? Great. So I'm just finding that crest, kind of going under it. And then just wiggle it around a little bit. See if I can't get it to move against, in rotation against the SI. It's like, no, no thank you. So I'm just kind of pulling down and away. There we go. Feel that there.
I feel it, but I'm like, let go.
Yeah, I mean, that's why we hang out there, right? We give it some time. So I'm feeling that there is some restriction actually through her obliques. So I'm just going to start going up there and just giving it a little bit of attention. And what's nice is as that happens, as this starts to soften, because it's in relation, this begins to soften as well. Cool. So I'm going to ask you to put this elbow kind of here, just to keep you upright. And then we're going to go, so bring this knee up to meet this guy. So bring your bottom knee to meet, no, just up.
Oh, this one?
Yeah.
Okay.
I'll do this part. Okay, good. And push. See how much easier that's gotten? Way stronger, right? More. Keep going, keep going, keep going, keep going. And down. Good job.
So the main player I feel in getting that up is the outside of my left leg. Is that where I should be? That's where I feel like I'm recruiting. The bottom that's touching the
of your left leg. No, it should, you really are kind of, but when you're pushing, that should be right there.
Okay.
But
do you feel like I'm doing that?
I do.
Okay.
Yeah.
You would know.
Great. So turn over again for me.
On my side.
So what I'm doing is I'm forcing that L5 into action rather than, so it's like an isolation exercise. So you might feel it at certain places, but it's not the. You should be able to. Okay. So this might actually be kind of funky here, funkier than I was expecting it to be. See how there's a little bit more restriction there? Cool. So go ahead. Keep pushing, and release. Let Oh wait, that felt awesome. Ooh. Yeah. Oh yeah, but can you even feel how this is starting to move a little better? That makes me happy.
That's tender.
But not like someone punched them straight in the face. All right, good. Here we go, and up. Keep going, and then push down. Push down, and release. Whee! Oh, but how much better?
Yeah.
Cool. Great. Nice. Okay, cool. So, back over the other way. I want to get into that iliacus again a little bit more. And I'll do it supported this way. So I'm going to ask you to extend this top leg for me, all the way back. Good. Keep going if you can. Great. Whee. And then put this arm up for me, please, above your head. Yeah. Cool. And then just bend the knee back for me. No. Yeah. Make sure you're all tucked away here. Cool. And relax. Good. So all I'm doing is putting this into a really deep hip flexor extension. And I'm activating right in that iliacus. So I'm not deep in the psoas, just actually not ready for it, where psoas is a little bit weak. There we go. Okay, so let's turn you face up again. Okay, we'll just finish off here. I'm just going to release the shoulders a little bit. Are you comfortable with the temperature?
Yeah.
Okay, great. I think there's a cold metal tool in there. No, it's over here.
Haven't found it.
I'm like, this is so relaxing. It's just a freezing cold metal tool wasn't by my legs. All right. So it's really, really important, particularly when you're dealing with the spine, that you deal with it as a full system. And what that looks like and what that means is releasing the atlas and axis in some of the cervical spine. If not, the best way to describe it is kind of like tension gets stuck unnecessarily through the head and shoulders. So we've affected a ton of change, but if we don't create that change for the shoulder system as well, it can kind of have effects on the lower lumbar. So just taking some time, releasing some of the fissures. I'm going to release some of the temporal and parietal fissures around the skull. And just give a nice deep cervical release. Get into that atlas and axis. Our sub-occipital lobes are pretty much always a little bit tight. Drop here for me. There we go. Just drop, give it to me. There we go. And so as I support and create space in between the atlas and axis, essentially your skull and first cervical spine, I'm going to also give a little bit of some trigger points into her medial and anterior scalenes. Because we use the head to turn and move, it's a really dynamic system. Try to drop into my hands like they're a pillow. The worst pillow
It
ever.
felt like a pillow, maybe.
The worst pillow ever. Drop, drop, drop. There we go. Ooh, that's lovely. Drop, drop, drop. Good. little stuff. So these are the muscles through your skull. You have all these joints in your skull called fissures. Like if you've ever looked at a skull and it's got like all those little lines, those are joints. And so if those get impinged or impacted, they can have all sorts of crazy effects and symptoms. There's a little access to the ectomoid through here. Drop here. There we go. Good. Just relax. And there we go. It's giving me a lot of resistance.
Hurting.
Yeah. So the bookmarks I have are the tops of the feet again, and this area. Generally, because I like to work progressively with my clients, so the way I like to work is building on top of the work that was done before. So giving her some homework. All right, so I'm gonna go in here. Definitely want to get into that medial scalene on this side here. Unclench your jaw for me. There we go. Just open your mouth completely. There we go. Oh, so much more access. Actually, I'm going to release that TMJ today.
You want to know this one?
No, it's fine. See right there?
Yeah. It's like a bruised.
Right?
Like I bumped my head or something.
But notice what happens to your neck as we release this. You see some of those tension points start to feel a little better? It's all of those dynamic fascial lines.
And what are you feeling as you're pressing on that spot?
I mean,
Is
so
it tightness?
yeah. So oftentimes, I like the analogies of meat products for muscle. So like raw meat versus overdone meat versus like medium rare. What's happening there, right? And what are you looking for? So there I can feel a little inflammation. In fact, almost a little nodule. That's how tight it is there.
And what causes tension up there? Is it just like...
Honestly, so again, we have a fascial line, a deep back fascial line that attaches from the tops of your eye socket to the bottom of your feet.
Wow.
Right? So we are a full comprehensive unit. We aren't disparate parts. So your head is affected by your spine, is affected by your hips, is affected by your feet, right? So while we don't always have to work on every part, it's important that we think about what we're doing comprehensively. Awesome. Well, that feels so much better already. This we have to bookmark. Like that's gotta go.
Right.
All right, I'm gonna just release your jaw. Do a super quick little TMJ here. I just want to get to that medial pterygoid in there. Okay. Open for me and relax. Just there. Open slightly. Relax. Have we done TMJ?
No.
Oh my god. Why not? I'm always so focused on your hips.
We got so many other bad things.
Open and close.
Oh
Feel the
my
difference.
god. Ooh, my eyes are watering.
Yeah. But open and close and feel the difference.
Oh, yeah.
It's crazy.
Right.
I mean, we were in there for what, 45 seconds?
Yeah.
Yep. And relax. Yeah. and close. And open and relax. If that's possible. Okay. Open and close.
Eyes are watering.
I know. But your shoulders feel better.
Yeah.
Cool. Your hair thing is right next to you.
Alright.
Thank you so much.
Thank you.